Great to be here. Barbara, I can't believe it's been years that we've sat around a virtual table with our colleagues in 10 other countries, and then a year or more that we've sat around the table virtually with Irish colleagues doing a deeper dive on what's going well in your current system and how we can think about doing better in future. I'm going to speak about features of an effective, I'm going to call it an evidence support system. In Ireland, I find more often you call it an evidence ecosystem. I'm going to talk about how I see that as being a slightly bigger concept. And hopefully give you some concrete ideas about things that you may want to try that you may not already be doing. So on this slide, and it's the busiest slide I have, most of my slides are visuals, but I just wanted to walk you through what effective could look like. So imagine a world where you have a government policymaker trying to figure out, can she make the case for action? So she's trying to figure out, do I have a compelling problem, a viable policy, conducive politics? And to her credit, she wants to know what the research evidence says, and she wants to put that into the mix alongside all the political considerations that she needs to be thinking about. So in one business day, she gets back an answer that we have local, so local from Ireland, data analytics about the scale of the problem, also about changes over time, but we have nothing from Ireland about the drivers of the problem. Then she's told we have an evaluation of the one solution that's been tried in Ireland, of the 7 that have been tried globally. There's one local behavioral or implementation science study that's been conducted about the one solution that's tried here, barriers and facilitators to spread and scale, but nothing about any of the other solutions. No local studies looking at qualitative insights, particularly about how equity-deserving groups view and experience the problem and options. And she's told there is a really good evidence synthesis that gives us some insight from other countries around the world, particularly ones that are like Ireland, that gives us some insight about some of the common drivers that have been found and also what we know about some of the solutions. So she asked for those actionable insights to be distilled, half-page note. What do we know, with what confidence and with what caveats, and what don't we know from the available research evidence? And then she can work out how to plug that into her briefing to the minister. So that, to me, is what effective could look like. One day, turnaround, this is what we know, this is what we don't know. So how do we get to a space like that? So one priority would be thinking about responsive trades. Different researchers are trained to do particular things. So if you're renovating your kitchen, you need a plumber, you need an electrician, you need a tiler, you need many different trades. And in the evidence world or research world, we have our different trades. But ideally, we have some of those groups that are committed to do that work in timely and demand-driven ways. They may be sitting in government, like Chris's shop in the Ministry of Health or Department of Health, or they may be outside government, like the one that sits in the HRB. So those groups need to be able to synthesize the existing research evidence. And nowadays, a lot of the groups that do this type of work have found ways to do it in a couple of business days. In the old days, it used to be many weeks, if not many months. Many of us now try to do this within 1, 2, 3 business days. And what we try to do is say, what studies do we have from our local country? And we're always looking at 5 different forms of evidence: the data analytics, the modeling, the evaluation, the BSci work, and the qualitative insights. What evidence syntheses exist? They give us insights from around the globe. And are there any local recommendations or global ones from places like the World Health Organization and others? They may take the form of technology assessments, or they may take the form of guidance. So that's a way to quickly leverage the existing evidence that already exists. Another way to do it is to say, we're always going to have gaps. So how do we fill those gaps with a flow of new research evidence, ideally in 2 to 6 weeks? The way I used to organize my research life was, at any given time, I had about 40 projects. And each one, I would push one a little bit further ahead, and then I'd run over here, put out a fire on the second one. And they were all moving very slowly. How we've now organized our working life is, on a Monday, we often don't know what we're doing because we don't know what call is going to come in that morning from any of the 5 federal government departments that we run evidence service mechanisms for, or any of the provincial governments that we run service mechanisms for. But when a question comes in, we can use an all-hands-on-deck approach to get everybody focused on the same project. And with this timely research, it means pre-approved research ethics board submissions, different ways of organizing your research teams, and moving incredibly rapidly to get out in the field, do the data collection, do the analysis, and write it up. And again, you can have rapid local research of any of those 5 forms of evidence. You can have a rapid updating or reanalysis of an evidence synthesis to answer the more precise question being asked locally, or you could have rapid adaptation of a technology assessment or a guideline. One of the things that is making that middle column dramatically easier is the emergence of something called the Evidence Synthesis Infrastructure Collaborative. And Teresa McGuire from the HRB is a member of the Funder Interest Group Executive for ESSEC. This is going to be a game-changing investment in policy-scale, AI-enabled living evidence syntheses that will mean it's much easier to quickly pull down the already extracted data, the already conducted risk of bias assessments of any study, and to rapidly contextualize them to a new context. In future, you'll be able to rapidly access the insights that come out of these policy-scale AI-enabled living evidence syntheses, or you'll be able to slice and dice them in a new way. So Declan and team at Evidence Synthesis Ireland pull down the data, contextualize them quickly to the Irish context, and share them with a busy policymaker. So that's one priority, the timely, demand-driven evidence units. Doesn't mean the researchers shouldn't still be out there doing their investigator-driven research over longer timelines, but we can organize ourselves in ways that make us much more timely and demand-driven. Second priority for evidence support systems is a good general contractor. So when I did renovate my kitchen, I didn't want to have to figure out the plumber and get her there on the right day, or the electrician, get him there on the right day. I wanted to hire what in Canada we call a general contractor, who will get the right trades in on the right day, doing the right type of job. And in my world of supporting evidence-informed policymaking, we call them an evidence intermediary. You may call them a knowledge broker or something else. Again, they can be inside government, and we work with a lot of units that have them inside government. We function in this way outside government, but under contract to a number of other governments. So again, 2 options here. You could choose to go with both. Option 1, rely on well-positioned individuals who can hear that policy question, realize that that means they need to quickly find 3 different forms of evidence, liaise with the right groups. One group's at Trinity, one group's at Galway, someone is in another group, and quickly package the response. Another way to think about it is have a unit that specializes in this. And again, this is what we do. We have colleagues in Brazil and South Africa, many different countries that run units like this that do that general contracting job. Manage the intake and prioritization process, do the horizon scanning so you can also identify issues that policymakers may need to be thinking, triage the request pipeline, coordinate the units, and then manage the integrative research work that gets it back into the policy process. So these groups tend to be neutral, independent. No one ever knows my political position on any issue. My job is simply to deliver on whatever timeline you give me, the best evidence that we can find, a sense of the confidence you can place in it, and any caveats that go along with it. So who's well positioned to do that general contractor role? Not every researcher is trained to do this well. Some researchers are trained in forms of evidence that lend them a bit better to this being able to mix and match the right form of evidence to the question. In countries like Canada, they're often evaluators who are used to looking at and finding different forms of evidence. They're often behavioral and implementation scientists, and sometimes they're economists who see the value of different forms of evidence, not just the ones that they're typically very good at, things like data analytics. So think about how do you build on folks' skills that are almost there in terms of those general contracting skills. So I agree entirely with Fergal that ideal policymaker cycle or policy cycle virtually never happens in the way that it's described. But it's a helpful heuristic to remind us that we need to be convinced there's a compelling problem, a viable policy, conducive politics, and at any stage in that policy cycle, certain forms of evidence are helpful. So if I hear a question about a problem and its causes, my brain goes to get me the data analytics, tell me if there's any modeling data out there, do we have any qualitative studies that tell me how different groups view and experience a problem? If somebody says to me, I want an options workup, then I'm looking for different forms of evidence because I'm particularly interested in benefits, harms, cost effectiveness, and so on. If somebody asks me an implementation question, then I'm looking for other forms of evidence, behavioral and implementation research or qualitative insights. And if someone asks me to think through monitoring, evaluation, and so on, then again, I'm looking at data analytics, evaluation, qualitative insights. Countries like Canada are super duper obsessed with one form of evidence. It's always about data analytics, but you only see data analytics twice on this slide, at the front end with the problem workup and the back end with monitoring implementation. The one form of evidence that you see at every stage are the qualitative insights. What are everyday people experiencing in terms of a problem? What have been their experiences with solutions? Same with service providers like teachers, physicians, and so on. So different forms of evidence help us with different types of questions. But a good policymaker or a good contractor doesn't just want the evidence from Ireland. They also want to learn from other countries. No matter how big you are, even if you're the United States with an incredibly big research base, you can't have studied every question in the world. You have to learn from other people. And that's where we turn to evidence syntheses. So here we ask the question, what have we learned from around the world, and how did those findings vary by groups and contexts? And then it's the findings from groups and contexts similar to your groups of focus or your context that you want to pay a lot of attention to. And then policymakers often want some other things put alongside the evidence when we do these evidence workups. So in Canada, I don't think we've ever avoided a question where part of it wasn't also do what we call in Canada jurisdictional scan. So as a federal country, we always need to know what is every Canadian province, what are all the territories doing. But policymakers will often say, we hear Ireland's doing some neat stuff. We hear Australia's doing some neat stuff. Can you document what they're doing and what they've found from evaluations and put that alongside this more traditional scientific evidence? We're often asked as well to do horizon scanning, sometimes to do key informant interviews, and very often we convene citizen panels or stakeholder dialogues where we put the evidence alongside all the other factors that are going to drive decision-making, all those political considerations. But to do those, we need more like 4 to 8 weeks, a longer time horizon. So a good general contractor is hearing the question and then mix and matching the right forms of evidence and the right other types of information to inform the next steps. For those who aren't involved in those high-level advisory and decision-making processes like Fergal described, but are more focused on helping to support changes in the practice of frontline nurses or teachers or others, they may be thinking more about how do we support learning and improvement in the field. And in that world, you're asking questions like, where are the system gaps, what's driving them, where are the inequities, what priorities are we addressing? We're asking questions like, what evidence-informed solutions exist? How will we adapt or design them with input from system users and communities? And then we're asking, does the model work? How and for whom? What adaptations are needed to cement and scale? So if you work in health, you may recognize this as learning health system thinking. If you're working in other fields, you may use slightly different language. But same thing happens. For each of those gears in the learning health system action cycle, different forms of evidence are helpful. So up front, it's much more about the data analytics. As you come to the middle piece, it's more about evaluations that give us insight into benefits and harms, and so on. So that need to mix and match forms of evidence just as present when you're trying to implement on the ground, out in the field, as when you're trying to inform big parliamentary and other decisions. So third and final priority for an evidence support system, a good client. an engaged leader wanting evidence in the policy mix. But again, as Fergal described, at the end of the day, policymaking has many, many factors that come into play. Evidence is one, but you do need a leader committed to wanting evidence in that policy mix. And again, I've put two options in front of you just to get you thinking. You can rely on well-positioned individuals who get it. And sadly, there aren't that many Fergals out there. There aren't that many Barrys out there, at least in my world, who get it, mean it, and try to implement it in their day-to-day work. But those that do see or create windows of opportunity. They turn to trusted aides. They ask really good questions, and they feed that evidence in just in the right time alongside all those other political drivers of decision-making. Second option is tackle this more at the level of the entire system. Ensure that the enablers, the culture, and capacity are in place. And I think we're going to hear from a speaker on the panel who's going to talk about how this is starting to happen here in Ireland. Make evidence use the new normal. It is a systematic part of every process, as Barry calls for in the handbook. Leverage robust mechanisms. I've given you a number of examples that you can decide whether they may be appropriate in your context. Rely on the right questions being answered. And I don't know if you remember back in the old days where laptops had Intel inside. It was a brand. And that's always stuck with me. Do we have the evidence inside? It may not be that visible at times, but can we point to it and can we reassure ourselves that it has gone through a process that made sure that that intel was inside? So these are the features of an evidence support system, and this is what Barbara is going to describe to you using this framework, what was found in Ireland. But if I go through them now in reverse order briefly, a good client, so an engaged leader wanting to have evidence in the policy mix, a good general contractor, that evidence intermediary that has experience with the policy side, can hear the policy question, but has experience on the evidence side and can know what that means in terms of the forms of evidence, how you assess quality of that evidence, and so on. Those responsive trades. And then through intermediaries like Teresa, well connected into that global evidence architecture, pull in that key global evidence. And that world is moving really quickly with new AI innovations that are really going to shift what that work looks like at the local level. So we've tried a similar effort to what you're doing today here in Canada. It was about a year ago, and we asked a question at the end of the day, what is the most likely scenario in the coming year? And almost everybody said the best we could hope for was a coalition of the willing. Some optimistic, we'd get a big step change improvement in our evidence support system, slightly lower percentage thinking we'd just see incremental improvements. I'll admit I was a bit heartbroken that we just had a few people that thought we would see bold leadership that would really shake this up and build a better evidence support system in Canada. Thankfully, no one was honest and picked the other options. I'm also going to be honest with you that a year later, it turns out what we did was 4. No significant action, and nobody's called them on it. Now, the excuse is, I don't know if you've noticed, we have a big neighbor to the south of us who has thrown off our politics, and we have other priorities right now. But now also seems to me like a good time to ask tough questions about how we make sure we make informed decisions. So another thing that we learned from the system is when we started talking about the evidence support system, we were painting it in all of its complexity. And you have some people in the room like Fergal and Barry who know a lot about advisory and decision-making processes. So they're listening with one perspective. Then you know a lot of people trying to change things on the ground with teachers and nurses and other people. Then you have a lot of people that know what everyday citizens are grappling with and the people who serve them. Then you have people like me who work as an evidence intermediary. Then you have the folks that do that timely, demand-driven evidence support for very specific forms of evidence. They really know data analytics. And then you have funders like HRB that know a lot about funding research, some aspects of which will be relevant here. So we were describing for a really long time an elephant, But most people don't need to know it's an elephant. They just need to know the piece of it that has the biggest impact on them. So another lesson learned. HRB, I think, has a key role in formalizing and strengthening this evidence support system. We see it as distinct from the research system and the innovation system, and how it should be measured, what its performance should look like, has to be different. So over time, I'll just say, there's a lot of reasons why now. We have not, in the last year, convinced senior Canadian federal policymakers that now is the right time. I hope it is the right time in Ireland. You'll see 3 things laid out here for why I think now is the right time. So thank you very much for having me. Look forward to chatting with you over the coming day. Turn it back to you, Barry, and sorry for going a bit over.